No. Hello.
Hello. Hi, I'm Hildy Hinkle. I'm
Are you
one of the
Hildy? Oh,
yes, one of the presenters.
nice to meet you. I'm Amy Croucher. I'll
Hi. Oh,
be
hi. I've seen your name.
yeah, facilitating today.
Great. I know I'm a little early. I just wanted to make sure my tech is all working. So
Yes, good idea.
good to go.
I appreciate that. Okay, we are at time. Hildy, will Sarah and Yami be joining us today, or are you going to be presenting?
Oh no, I definitely need
Okay.
them. Yeah, they'll be
Okay.
presenting with me.
Okay. We are at time. Thank you everyone for joining. We're just waiting for a couple more of the presenters to appear and then we will get started. Hi, Sarah. Thanks for joining us. I think we're just waiting for
Hello.
Yami.
Fantastic. Well, while we're waiting,
Mhm.
I know you're going to introduce us, but one of the
Yeah.
things we did, I'm just going to say what my when we were doing project management for the work group we're going to talk about is we always ask people if they had any needs for the meeting. And I have a couple multiple needs today. So I figured I'd tell them I'm single
Okay.
parenting. My daughter will be home very soon. And we have a brand new puppy in our house that you can all meet. Who actually
Oh,
doesn't do the best unattended with my kids. So I'm trying to keep
okay.
him the puppy here with me. So, we might have some barking or we might have, small kids joining. So
Appreciate
those are some of
that.
my needs today. And we incorporated that into our community
Thank
partner
you.
work group that we're going to talk about is asking people any needs they had.
Wonderful. Does anyone else have any needs you'd like to share before we get started? Okay, not seeing any or hearing any, so I presume we're okay.
And
Just
Yami was presenting from 2 o'clock to 3 o'clock. So she
okay,
is running between presentations. So she'll be with us
understood. Thank you.
momentarily. There she is.
There she is. Great. Okay, we'll go ahead and get started. Welcome, everybody. On behalf of the Oregon Project Management Advisory Board, I'm Amy Croucher, your facilitator today, and we'd like to share a few housekeeping items before we get started. As you may have noticed, this meeting is being recorded. Please mute your phone or PC if you're not speaking to help reduce any background noise. Also, if you're not speaking, you're encouraged to remain off camera. A link to the meeting resources will be shared shortly after today's session and posted on the DAS YouTube channel and OPMAB website. If you have any questions, raise your hand or place questions in the chat and the presenters will answer them at a convenient part of the presentation. Also, if you're interested in business and analysis processes, the Business Analyst Networking Group meets the third Wednesday during months in which PMUG does not meet. So they are also looking for a new planning team member. So for more information, visit the Bang website posted in the chat. You're welcome to share with your colleagues and encouraged to spread the word about our PMUG Wednesday sessions. I'm pleased to host this session presented by the ODHS, OHA, and DCBS Community Partner Work Group. Our presenters today are Sarah Dobra, whose pronouns are she, her, and Aya. Sarah manages the Oregon Health Authority Innovator Agent Ombuds Program and feedback teams. At OHA, she works to help OHA make operational through policies, program, and implementation the incredible wisdom that individuals and communities in Oregon share with her teams each and every day so that OHA can work to center Oregon Health Plan services on those receiving those services and work to eliminate health inequities. Hildy Hinkle, whose pronouns is MPH, whose pronouns are she, her, is a project engagement and outreach manager at OHA. Hildy is responsible for ensuring OHA's partners and Oregon communities have a voice in special projects, initiatives, and policy. She has been at OHA since 2016 and has over 15 years of experience in community engagement. Hildy worked in the media at nonprofits and as business owner before coming to the state service. She studied political economy at the Evergreen State College and has a master's degree in public health from State University of New York. Yami Gonzalez, whose pronouns are she, her, and ella, is an innovator agent within the External Relations Division of the Oregon Health Authority. In her current role, she serves as a liaison between the different pieces of the healthcare system, community, OHA, and coordinated care organizations. Growing up in a small town in Eastern Oregon, she has a deep passion for elevating community voice and finding innovative solutions to complex problems. Yami holds a biohealth sciences and public health degree from Oregon State University. They'll be talking about the Community and Partner Work Group, CPWG, established by House Bill 4035, which was chartered to advise the Oregon Health Authority, the Oregon Department of Human Services, and the Department of Consumer and Business Services on the development of outreach and enrollment assistance and communication strategies to communicate and assist medical assistance program enrollees in navigating the redetermination process and any transitions to cover through the health insurance exchange. The CPWG brought together representatives from impacted health systems, community partners, organized labor, individuals enrolled in medical assistance programs, tribal representation, and members of Oregon's Medicaid Advisory and Health Insurance Exchange Advisory Committees to advise the state and the departments on the development of outreach and enrollment assistance and communication strategies to communicate and assist OHP members in navigating the redetermination process or transition to cover through the health insurance exchange. The work required a cultural shift in project management work at the Oregon Health Authority with a focus on co-creation. All right, take it away, ladies.
Awesome. Let me go ahead and share my screen. Thank you so much, Amy.
And thank you. And like I said, yeah, thanks for sharing screen, Yami. And like I said, excuse my barking companion in the background. I'm Sarah Dobra, and as Amy said, I use she, her, aya pronouns. Yami, I've not seen your screen yet. Okay, there we go. Fantastic. So I do want to really recognize neither Hildy, Yami, and I are not project managers, but I think we come to all of you with deep who have deep project management experience with humility and openness to learn from you, and do want to recognize we actually did have additional really critical support in this work that we're going to be talking to you about today. We did have an actual project manager, Lily Borak is her name, and we want to give a great shout out to and thank her because that work would not have been essential without her. We had also some incredible admin support as we began this work who provided critical work of not only project management, bringing the work group together, but also just really being part of that person and nurturing that was essential for this work group, and a facilitator, Michael Anderson Nathy, who also just did incredible work to create some of the values and environment we wanted to set up in this work group. So really want to say, although we're speaking to project managers, none of us are, but we hope to share things that we learned along the way, or maybe wish we had known as we set about to do what state legislation directed our 3 state agencies to do. So we can go on to the next slide. And what we were asked to do is during COVID, I'm going to get just wonky for just a moment and then I'll stop, I promise. Or if I don't, someone can call me out on that. During COVID, generally anyone who is on the Oregon Health Plan or oh, sorry, I'm jumping ahead of myself. I was going to get background, but you know what? First, I tell you what we're going to do today. So today we really do want to discuss the role of project management in legislative mandated work groups and how project managers can support state agency staff on recommendations and agency implementation. And we want to have like honest conversations about where we felt that we were able to do that, where our challenges were and opportunities we see in future work. And we want to talk about what the challenges are and how project management can support that. And then finally, we did take the work we did and create some very specific tools for work group management to truly work to bring community voice, wisdom, and experience into agency operations. So we do want to also show that to you. We can go on to the next slide because I was just starting to get ahead of myself. This is where I'm going to become wonky for one moment, and then I will stop on that. Generally, anyone who is on the Oregon Health Plan, which is anywhere between pre-COVID, about a quarter of people in Oregon to during COVID, that became a third of people during COVID, must be redetermined for financial eligibility for Medicaid benefits on a yearly basis. During COVID, the federal government ended that requirement. And so no one lost Medicaid eligibility. And so that's where 1/3 of our state's population was receiving Oregon Health Plan services, 1.5 million people in Oregon. There was both federal work and then House Bill 4035 was set up to direct Oregon Health Authority, Department of Consumer Business Services, and the Oregon Department of Human Services to use all available tools and resources to them to support that redetermination process and ensure that individuals who should have coverage did not lose coverage in that. So we have a picture here of incredible amount of paperwork. That's what eligibility and navigating state processes often does feel like, and yet we did really put concerted effort into reducing that as much as possible. So that's a little bit of technical background of why we had a work group formed. And with that, I'll turn this over to Yami to talk about a little bit more of the specifics of it. And as Amy said, if you have questions along the way, just reach, ask them, put them in chat, and we'll either answer them as we go along or say we're going to get to them later on.
Thanks, Sarah. And I'm happy to cover this slide, but I don't know if you wanted to kind of point out some of the language that came with the ask from the legislature.
Oh, sure. Well, and I think we highlighted here, these are things that felt really stressful to us and might feel stressful in a future situation. So we were to immediately convene a work group. And how do you immediately convene community work? And then we were really told that our agencies should do everything that work group recommends us to do, but within the legislatively approved budget. And that the authority was to incorporate the work group recommendations. So just calling out some of that enabling legislation, and yet how do you make that operational in reality and truly take a immediate work group with diverse community members and support 3 state agencies to incorporate those into operational and policy actions. And that was the task that was set before us through this legislation that we learned from along the way, and we'll keep on learning from, I think. So thanks, Yami.
And thanks, Sarah. As mentioned, my name is Yami Gonzalez, and wanted to share with you a little bit about our project management role in this legislative mandated work group. So as Sarah touched on, The work group purpose really was to advise OHA on outreach, enrollment, and communication strategies to help people that were currently receiving the Oregon Health Plan navigate the changes redetermination process is kind of the term that we use, and to really maximize the continuity of coverage for as many people as possible. So the scope of the work was to recommend and provide advice to OHA on strategies for obtaining and updating member contact information, outreach and communications regarding the redetermination process, and availability of navigator assistance. We were tasked with maximizing awareness of and utilization of navigational assistance, other strategies for redetermination to minimize the loss of coverage, and maximizing our use of community-based organizations and other organizations to provide navigational assistance. So really lots of project management in order to be able to carry out this purpose and scope. This is what our community partner workgroup membership looked like. We had representation from a widespread of sectors. We had community partners, current Oregon Health Plan members, or individuals who had been enrolled in the Oregon Health Plan in the last year, or who had transitioned to the marketplace, private insurance, Medicare, or who had lost health insurance coverage recently. We had representatives of impacted health systems with focus of representation from across the state. So this including coordinated care organizations, hospital systems, and clinics. We did have a representative of organized labor. We ended up appointing a tribal representative that was missed in the legislation. So we adjusted the charter and added a tribal representative. We also had a representative from the Medicaid Advisory Committee, and a representative from the Health Insurance Exchange Advisory Committee who was also appointed. And then with this, we kind of just wanted to touch on some challenges and opportunities that we saw where project managers really play a role in creating a space for community wisdom to be heard and acted upon. And I'll pass it back over to Sarah.
And I think what we wanted just to do here is I will and Hildy, we'll share just like a challenge and opportunity we each saw in this work. That's a little bit of a discussion and then go through some other additional ones. But I know for me, we were navigating an incredibly complex topic because we were told to stand this work group up immediately. Our agencies that were to lead this work were still operationally figuring work out. And the understanding of communicating transparently, even when policy decisions aren't made, so that a work group and community can actually be part of that decision-making process, as the legislation tells us to do, was a tremendous challenge for state agency staff who were asked to come to our work group as subject matter experts to present information. We are, at least at the Oregon Health Authority, we are the Oregon Health Authority. It's an uncomfortable space for many staff to go to a place where you don't have the policy decided and to talk transparently about that when your job title includes being the authority. And so that's one challenge we encountered, is how to transparently speak about complex work that isn't yet decided to community and to this work group so that they could actually decide it and act on that. One, I think, opportunity along that lines that we began to do was to meet with anyone coming into the work group to speak before they came in. And we did that specifically to create expectations and understanding of what that should look like, why someone was coming in, how they could speak transparently. And then I think just along that lines, we actually had one situation in which, as we're talking about public benefits and opportunities to navigate that and challenges, we had a staff person, an agency staff person, who spoke in a way that was incredibly discriminatory and derogatory towards those who were to serve in a public meeting. So I think that was a challenge of how do we truly do cultural shift and change to center the voice of those we experience and the values and goal that the state legislature and our agency leadership had committed to help individuals keep and maintain health insurance. When there were sentiments of it's a benefit, you must justify, there was just statements said that we actually had to address and navigate in a thoughtful way to communicate both internally to staff and to those in the work group. These are values. If something was spoken differently, that is not what should be said. So just management, people management, and setting expectations ahead of time, and during is something that was both a challenge and a really cool opportunity to center community voice. And I'll pass it to Hildy. And Hildy, Yemi, and I didn't talk about these in advance of what we were going to share. We just, every time we get together, we have different reflections on this work.
Thanks, Sarah. Yeah, I very much agree with all of the challenges and opportunities that Sarah talked about. You know, in working with many partners, they're not familiar with the inner workings of state agencies, and the work that we do is very wonky, it is very detailed, and it can be very hard to access. You know, there are things that, you know, working as professionals in our agencies for years and sometimes decades, there's bodies of work that we don't understand. That's why there are so many of us contributing to this work. And so being in a position where we're helping translate between our partners and our internal staff who are interacting with those partners was also a challenge and an opportunity. So from a project management perspective, I am thinking of it in terms of making sure we have content in advance, well enough in advance that we can do a plain language review of that content, making sure that our partners it's going to be presented in a way that's going to be accessible to our partners, to the members of the committee, and taking time to prep our colleagues within the agency about how to come into the space and make the most productive use of the time, what their purpose is in both listening and providing information to the members of the community and partner work group. And Yemi, I don't know if you have anything to add.
Yeah, I thank you, Hildy. I don't think I have too much to add. I agree with the things that have been mentioned by you and Sarah. The only other thing I would add is kind of just going along the lines of, you know, state agency staff not always being used to coming to these community spaces and really community-led spaces, such as the case of this work group. I think looking back, that's probably one of the greatest, you know, accomplishments that I would highlight that we were able to accomplish is really just creating such a welcoming space and really building relationships with the members of the work group. We spent months and months working together and developing all of these solutions and recommendations. And I would say from a project management perspective, this has probably been one of the coolest projects that I've been able to be a part of, because it allowed the opportunity to really build relationships with experts in the local communities that truly know best what works for them. And with that, I guess I'll kind of keep us moving and cover just a little bit of what we did for facilitation and member support within this work group. We again really emphasized and really strived for creating a welcoming space. Members were greeted by name every time they joined the virtual meeting room. We always made space for introductions and addressing any needs or accommodations that were needed to be able to participate and engage fully in that day's conversation. We watched participation in the meeting and made sure to allow space and provide opportunity for all members to share feedback, as well as elevating certain members for specific topics. Our member support, we made sure we had timely distribution of materials in advance of meeting, and also got post-meeting materials sent out on time. We limited outside of meeting tasks for members, really tried to value our members' times and tried to make the most of it so that we didn't have, them completing outside of meeting tasks. We made sure to have staff available to provide individual support and clarification to members. There were countless times where myself or Hildy or Sarah, hopped on a call in the afternoon, in the morning, whenever we could, just to make sure we were available to answer any additional questions. And then this work group was entirely member-led. So we had member-led creation of agenda and meeting topics. And then how we think that, project managers can really support the shared power to highlight and elevate community wisdom is some of the ways that we did this is we brought input, work group input, voice questions and recommendations internal to agency operations and policy. We had a public-facing website transparent with information about the work group. We had our meeting notes posted, our charter, our PowerPoint slides, everything basically that happened within the work group, we made sure to have available. We did kicked off a series of public-facing webinars that really highlighted and emphasized the importance and the role of the community partner work group. We had contracted communications that were vetted work through the community partner work group. We had pre-meetings with internal agency subject matter experts to prepare for the discussions and the topics that we would be covering in the work group. And then we also had legislative reports that we had to turn back to the legislature on our progress with the community partner work group and kind of the development of the recommendations that we were working on. And with this, I will pass it back off to Hildy. Thank you.
Thanks, Yemi. So we've discussed setting up the work group, creating an organized but flexible space for the work group where our partners could provide meaningful input and really take an active role in guiding our agencies as we planned for the redeterminations process once the federal public health emergency declaration ended. So we'll now talk about the work and organization that happened behind the scenes to act on the work group's recommendations. Next slide, please. So we have a list of the recommendations, which we can drop into the chat. So once the work group agreed on recommendations, there is a whole nother body of project management work behind the scenes to ensure that those recommendations are implemented within the agencies. And so that both the agency and the members that we serve benefit from the collective insights and wisdom of the work group. The Community and Partner Work Group, or what we call CPWG, grouped recommendations into 9 categories. They made 63 recommendations altogether, and then those fit into 9 categories and created a value for each category. So the idea of the values is that when it is not possible or feasible to implement a specific recommendation, then the state agencies could use the values as a guiding principle in the work. Next slide, please. So the importance of these values, these guiding principles, are that our partners, especially community-based partners, partners who are not themselves part of large bureaucracies or don't interact with the details of bureaucracies on a daily basis, they often don't really have insight into how we even do our work. So as a result of that, partners who do have that insight or access often have easier access to us, and they speak our language, so to speak. So we understand their requests, we respond to them more often, and they have more influence. So by summarizing the work group's recommendations into values that could guide our work, then that was a way where we could implement recommendations, even if the very specific recommendation was not possible. We could still take advantage of that wisdom by looking at these broader values that the work group was bringing forward. So this slide here shows the broad overall value of the work, and then the recommendations were further broken down into 9 specific values. So next slide, please. This slide shows one of the 9 values. This is the overall value for language access and language justice. And then there were 5 specific recommendations, which individually may or may not have been able to be implemented, but we could at least aim to improve our systems, our communications, and our approach to redeterminations based on the guidance of this value. And an important part of the work that we were doing in the background is that we were circling back with all of the internal teams, managers, and other staff who could be responsible for implementing each recommendation, and asking them to create a plan or to describe to us how they were going to implement that recommendation, or how they may have implemented it if it happened already, or if they were not able to implement it, to explain why that was not possible. And at the same time, incorporate this value. So again, this points to having the knowledge about the inner workings of the agency. If we weren't able to implement a specific value, was there something else that we could do to implement that recommendation? So you can imagine with 63 recommendations, it's a lot of tracking. So we had a very complex spreadsheet to manage all of this, and there were a lot of follow-up, and there was a lot of project management that we really leaned on our project manager to support us with. And then once the so that was an early report for the recommendations. How are we going to implement these? And then we also followed up with a report many months later with an update. How did we do? How did we implement these recommendations? And I think with that, I am turning it back over to Sarah.
Yeah, thanks, Hildy. And I'll just note in the slide deck that I think will be shared with you afterwards, we did hide slides that have some of the additional values and specific recommendations in case you're curious about those in practicality. But again, that was getting a little bit more into the actual implementation compared to the process, but did want to call that out in case you are interested. Some of that will be in the slide deck of additional values and work areas that the work group talked about. So this was hard work. I manage as my day job several teams at OEJ, as we talked about. One of those teams is our Oregon Health Authority Ombuds program. That team talks to and hears from Oregon Health Plan members when their access to care or quality of care has gone awry and it's not working out as intended. That's hard work each and every day, and taking that for systems improvement. This work was some of the hardest work I've done in the 5.5 years I have been a state employee at the Oregon Health Authority. It was incredibly challenging. And the reason why is matching up those values, that legislative intent, and the true commitment that I think Yami, Hildy, and I shared as we did this work to truly make that legislation and the work group, their input truly be valued and acted upon internal to state agencies, is some of the most challenging work I have done, because it's easy to say in name and much harder to do in practice. And so I think some of the tools Hildy talked about of like actual tracking what those recommendations are and responses are project management tools that were incredibly helpful in this. And yet it also was not always sufficient to truly do transformative change. The Oregon Health Authority stated goal is to eliminate health inequities by 2030. And we have a specific definition and goal around that. Putting that into practice, and part of that definition says the redistribution of resources and power means setting up tools and processes to empower community. But that's a cultural shift. That's shared ownership. That's being talking transparently about where you don't know the answers, and that's it's a challenge, and putting in the tools to do that. I think another challenge that we faced is both Yami and I are in our external relations division at the Oregon Health Authority. We don't do the actual program management of eligibility determinations or policies, but we have the skill sets to engage in the community, hear them, and amplify their voice internal to our agency. But it was essential to have those who actually have the subject matter expertise and could implement the work also be truly there along the way. So we can go to the next slide. I'll run through a couple of the other sort of both challenges and that. So, and I think I touched on a lot of these already, but it's a cultural shift. I think if you were to look at your state agencies, I'd be really curious too if people, I know we're gonna have time for discussion, but I'd be really curious too if people just even want to start putting into chat the different state agencies that you're a part of, and thinking about, are there legislatively mandated work groups in your state agencies? What is the actual scope of that? And is that actually being done, or is it a checkbox? Are we doing this because the legislation said so, or are we truly implementing the scope of a work group to impact and be part of change and systems improvement for our respective state agencies? So that cultural shift, transparently talking about challenges or barriers or what we might not know, and how to involve community before we know the answers, when we're still working those details out, or haven't even thought that that might be an issue in a complex area, was an incredible challenge and cultural shift. And that's, as I touched on, why we began doing those meetings with speakers in advance of the work group to create space and comfort for a different sort of skill set that we're part of. I love that people are already starting to put into chat what agency you're at, any work groups you know of, because this will really help to prompt some of the discussion too. And then, as Hildy touched on, operational work is complex, different words on that, and how we make community input truly operational, even when they use different words. So it takes a level of staffing and time intensity to staff that work group, both with project management, subject matter experts, the admin support, the really nurturing of staff, and just setting up that tone and environment to have amplify that wisdom and then act on it is entirely time intensive, particularly to make it meaningful. And then we really also faced, as we began this, a lack of operational tools and project management to implement the recommendations. Hildy did an incredible job developing many of those tools that really worked functionally, but there wasn't an established set of project management tools to uniformly implement work like this, and there continues to be a lack of standardized tools, although we have copied some of what we did here in multiple other agency-wide initiatives since then. So opportunities that we really saw is internal agency champions. They're really needed for each implementation area. So those 9 values we had in different areas, we needed champions that were subject matter experts to truly ensure that it wasn't just a check the box response, but truly a response that said, we are considering hearing what this means and acting on this as much as we can. And that took subject matter expert championship and understanding of this. We also had continuous community engagement and continuous action and responsiveness, not only through this work group, but also through additional mechanisms we set up as the work group did end its scope of work for what was set out by legislation. We closed that work group, but then also had ongoing methods for that work group members and the broader community to continue to let us know what's going on. And the values from community as driving the direction and documenting best practices for future work we'll touch. And I see, Amy, you have your hand up, so. Oh, you're muted though.
Apologies. We are evaluating compensating members of the public for participating on our guidelines advisory committee. Did you do any sort of that during the work group?
Yes, we did. And we also did, we absolutely did some of the individuals in the work group. So we had like the CEO of one of our coordinated care organizations. Like we had individuals doing that in the professional capacity, but particularly for those individuals who were organ health plan members, we set up, and there's state law around this now for compensation of work group members, and how to do that. And that's another project management process, like, and shepherding and supporting members to truly make that a ease of process. So yes, we did, and that was a separate project management full activity in itself, as that's a new area. So really
Great.
critical.
Yeah. Thank you so much.
Yeah, well, let's go to the next question. We want to have a little bit more discussion with you as well of just like I'm curious what other, and we do want to share some more things. So this is maybe like a mini pause or conversation if you go to the next slide, Yami. I'm curious, as you heard us speak and share some of our experiences, what other opportunities did you hear us talk about through this work group implementation? Or what other challenges did you hear from our presentation today about implementing work groups? And, as you're thinking about like this experience in this, and even that photo, there's incredible opportunities, even when, a dead log seems like there might not, and I don't want to say this work was a dead log, but like it's, what that maybe is a poor analogy, but even in challenges, there's incredible growth that can occur. And so I'm curious what you've heard of what we shared so far today. And we are going to share like one more section, but what were challenges you heard or that you experienced in similar work, or could see occurring in your agencies?
Well, one thing I can think of is that publishing all of your materials, did you advertise that the materials were available? Did you share this with a contact list, or how was this shared?
Yeah. So the work group itself, when we were setting it up, we advertised broadly and widely. We did a press release. We reached out to trusted partners. We advertised that in Spanish and English. And then we actually had a anonymous review by the different topic areas by multiple staff to really determine based off of the applications who would be on that work group. And it was a blinded review to select those members. So again, like pretty intensive project management just to set up that work group and ensure that we were sharing. We delayed, we had legislators calling us saying, why hasn't this immediately been stood up? The legislation said to immediately stand it up. And we said, well, tribes, the tribal or Oregon tribes were not included in the legislation. We need to include them. We said, we cannot do this without also advertising at a minimum in Spanish, ensuring that we have culturally and linguistically supported materials and that we have ADA accommodations for applying and thinking through those. So we had to push back and had calls from legislators, and yet we couldn't do our begin to even put into practice just minimum expectations that should be part of our daily work if our goal is to eliminate health inequities by 2030 without putting that into practice in our work. So, and then I don't know if you're asking about this too, but we had this as a work group that was not a public meeting, but rather a work group. And this was early on before work really began. There was a lot of attention by a lot of partners, some of who had like deep-seated interest in this work. Our coordinated care organizations had a deep interest in knowing what's going on because their membership had increased. If they were going to have a decrease in membership, that would impact them financially and the care they provide members, health associations. And yet we want to center this and understand those needs, communicate transparently, but also talk about and center the needs of Oregon Health Plan members and what their experience was. So early on when we began this work, we were the key communicators for the Oregon Health Authority and Oregon Department of Human Services, particularly around this, because we had not yet stood up a communications team or any mass media or anything to communicate about this. This work began before that, and that work was informed by the work group. So we would send out an email to our work group, and I knew immediately that that would be sent to I could see immediately within 5 minutes, usually, that other partners that were not a part of that work group had that. And that was fine. That was transparent. You know, anything we do is done transparently. So we also immediately stood up a website and had all meeting materials, agendas, our charter, and thorough meeting notes posted to that website to support that transparency, even while supporting the space for the work group to do its work. Again, a lot of project management and attention to details.
And I was happy to hear that you guys paid attention to plain language and readability, because I think that's really important. Does anyone else have any comments or questions? Feel free to raise your hand or put it in your chat.
I'll just add that though this was a legislatively mandated work group, and that is a big motivator to get something done, there are many times as an agency that we need to understand how our work is going to impact the communities that we work with, you know, our partners, lots of various groups, even other agencies. And so a lot of the things that we did here can be replicated in other situations as well, to make sure that as we're implementing policy, designing programs, or whatever it might be, carrying out the work of our agencies, that we are speaking to the people who are going to be impacted, who might have insights about how our policies land once they, the big wide world, and making sure that we're being responsive to that and incorporating that into the design of whatever the work is.
We have a question from Barbara. I'm curious about how long it took from the point you were told to go to get your first working session. Do you know, Hildy? This was during a short legislative session, so the legislation would have been finalized the beginning to mid-March. And I think we had the first meeting probably by the end of April, but I don't remember. I don't know if you do, Hildy.
April or May. It might have been
Yeah.
April or May.
And you didn't start initially either. You didn't come
Right.
into after we'd started. So I feel like it was probably within 4 to 5 weeks of from like the legislation being finalized, the legislative session ending, and member recruitment, and our first work group member orientation.
Yeah, that seems like an unreal speed for at least for our agency.
Yeah.
I don't know about yours. But I think that goes to what Sarah said earlier, but we did have support. You know, we had a contractor, Michael Anderson Nathy, who helping, you know, design some of our approaches and helping us figure out how to stand it up pretty quickly. And of course, relying on our colleagues in the agency who have stood up work groups before to provide us with the, you know, the structure, the application, all of those things to get it moving really quickly.
Yeah, the sum was
that's
greater.
An accurate description.
I'd say the sum was greater than the individual, or however that saying is supposed to go. In that there was just different technical expertise. Like our admin support and another colleague set up our screening process that was blinded, and we scored to figure out who participants were. Like, I couldn't have come up with that myself. I think I was like flat on my back with COVID, and we needed to pick up, like, you know, figure out, and like, so people picked it up. You know, it's just really that complementary skill set. But I will just say, like, I don't think that when legislation is passed, even in fiscals or in analysis, the accounting of the true resources and staffing and FTs needed to truly do work that goes beyond checking a box, to truly actually meet the intent of having community provide input, is calculated. And we did seek to do that. And actually, I can, if we want, I can transition to like one final section we wanted to share with all of you, that we took some of that in, but don't want to talk, you know, pause on the challenges and opportunities as people hear them as
There
well.
are a couple more comments in the chat. Did you just, do you want me to read it?
I think I got them. First one from Sanchi, it looks like, is if there was any project managements from the ODHS and OEP side. And thanks for the presentation. Specific project managers, no, but champions and leadership and subject matter experts on the Oregon Department of Human Services side, yes. I don't know if you have anything to add there, Hildy, but
I think that's a really good description. We did rely on our partners on the ODHS side as champions and to bring forward information. I think our interactions with ODHS and the work that they're doing really relate to Terry's comment from the Department of Forestry. Terry says they're working with 2 legislatively mandated work groups. One challenge we have is how to do the science, how did the scientists effectively and efficiently edit complex scientific documents while complying with public meeting laws. And Sarah, I think that goes to what you were saying earlier about this being some of the most difficult work that we've done. And we continue to talk about it as an agency. How are we doing this work? And one thing that one of my colleagues, Alfonso Ramirez, just said in a meeting earlier today, as a general guideline to provide to our partners, I hope I get it right. He said, content, context, and impact. So those are the things that partners really want to know from us. What is it that we are doing? What is the context that what we're doing fits within, and how is it going to impact them? And we make so many finely detailed policy decisions that change what impact means. right? So we make this decision, and partners are impacted this way. We change that decision a little bit and the impact changes to something else. So I empathize with Terry and how difficult it is to make that plain language, but that's really where meeting with partners, especially those impacted, is helpful, because they can point out those areas where the impacts on them are going to take place.
And we touched on, so we did ongoing community engagement outside, even after this work group ended. And Terry, I'm really curious to see what you've done with that challenge you have, but Yami actually came straight from doing this, but Hildy and Yami both have provided incredible leadership and both project management and practical work for our agency in ensuring that we have Spanish language webinars around this body of work, the public health emergency unwinding, and now other agency work that we are doing for our new 1115 Medicaid waiver that's bringing additional benefits. And it's incredibly complex, and I don't understand half the time in English. So the act of taking a presentation and putting that through co-creation with bilingual, bicultural staff in the agency who know the content and know the community, to do a Spanish language webinar that talks about the same topics in Spanish is time intensive and entire differently project management structure. If you ever want to have a project management conversation about that, Hildy is your person for that. She's done incredible work, and Yami is your person as well. But that's really, I think, helped us think through that. And we've had hard conversations internal to our agency that we've had to navigate with different values and understanding and conflict of people who care deeply about how you put something, when you have to take something and put it into another language. And I am fluent in both Spanish and English. And sometimes I'll take my own work that I know well and try to put in Spanish. And it suddenly makes no sense to me because I'm still thinking like up here. And so it's an incredible, that practice and commitment to accessibility and language for the top language outside of English spoken in our agency is hard. And yeah, I think it helped us do some of that at this, but I'm really curious from Terry, like how you've wrapped around that challenge of taking the complex work and having that comply with public meeting laws.
Yeah, so this is, my challenge is slightly different in the sense that some of the work needs to so this group of scientists is tasked in the long run with developing both technical reports and reports that are written in for the lay person. And that's still years down the road before we even get there. But part of the challenge is just they have to do very complex scientific discussions, analyses, etc. And so these are people that imagine a peer-reviewed publication that they have to edit, but they have to do it while complying with public meetings laws in terms of being transparent. And so these are people that are used to, hey, let's all put it on something like Google Drive and we'll all add our comments. Well, that doesn't exactly comply with public meetings law. And so how do we're literally wrestling with this right now, how to make this as smooth and effective as possible while still complying with public meetings law. And we don't have great answers other than, well, we're going to do small work groups where there's not a quorum and document everything, but it won't be done within a public meeting because it's literally hours and hours of conversations and editing, and so we're trying to figure that out.
Yeah, there's challenges, and as we talk about these transparency and community, and there's words we use at the Oregon Health Authority that are our Centers for Medicaid and Services, or CMS language that actually is incredibly discriminatory at times. And yeah, it's technical language that we need to use at times to talk about technical work. And yet, how do you take that in the community? And I think about this all the time. Well, let me transition to one final section if it's okay. Oh, Hilda, you have something to add though.
I make one more little comment. And I don't know if this is helpful, Terry, but one of the things that we did when we were submitting an 1115 waiver to CMS, that of course we have the 1115 waiver document. It was highly technical. Our most technically inclined partners, like coordinated care organizations, were in that document and giving us feedback, and they understood how to navigate it. But then we created different, I don't know what to call them. I'm going to call them levels, for lack of a better word, different levels of the same information. So we created what we call concept papers, which were basically policy briefs that were still somewhat complex, but they were not in that federal government regulatory language. And so that was for our partners who do this work a little bit more, but maybe aren't in the regulatory policy language as much. And then we created a public facing version of the same information where it was plain language. It was, it was basically a one pager front and back. That was for us, how Medicaid members were going to benefit or be influenced by or impacted by the work that we were doing. So, and that public facing one, we translated into the 13 most common languages that our members and partners communicate with us in. So we tried to make that one as accessible and broad as possible.
Oh, yeah, thanks.
Well, I want to share about, let's read the chat from, is it Aaron? Unrelated to anything else, but Hildy Hinkle, thank you so much for coming to one of the Black African American, African immigrant, and refugee community meetings. This is a touch between Community and Equity Office and Public Health Division. And you presented about the public health emergency unwinding. It was so well done. You took time to be clear and respectful of the needs, interests, and the time commitment of the folks in the room. Thank you. So shout out to you, Hildy, on that. Well, as we are doing this work, I just want to show one final area, and I'm happy to keep on having discussion with all of you. And your input is, I think of this as watching some psychology videos with my 7-year-old daughter that the school counselor sent us to look at, that talks about what happens to your brain when you are in stress mode. And it was the person on the YouTube video, I can find and put in chat if you want to, says you go into this lizard brain, like your little head is here, and you suddenly all you do is flight or fight reaction, or that lizard brain thinking. So when you are told, when you already have full-time job and in your 5% of other duties as assigned are told, you need to immediately stand up a legislatively mandated work group. And Hildy, you can go to the next slide. Your lizard brain kicks in and you say, oh no, let me curl up underneath my desk on the new puppy's dog bed and hide there until things get better. I didn't have the puppy then, so I didn't have the doggy bed underneath my desk, but that might be my would have been maybe my lizard brain response. And as we did this, we said, wouldn't it be nice if we had a documented process? Wouldn't it be nice if we had tools that would help you as we do this? So as part of this work, as we closed the work group, we took not only the work, our external relations division in 2023 did two legislatively, there was other work groups throughout the Oregon Health Authority. I don't want to diminish any of those, but we really led two work groups that had statewide agency impact. This community partner work group impacting 1/3 of the state's population, and then another work group called the Healthier Oregon Work Group that was incredibly transformative and community led in so many more ways even than what we were able to do, that implemented for 80,000 additional individuals full Oregon health plan benefits regardless of immigration status. And we are the first state in the nation to do that to the extent that was done. And was done through community-led work group for the Healthy Oregon work group. So in 2022 and 2023 as well. So we took and said, let's connect the dots of our brain, the little cable cords, to take that work that truly sought to engage community and elevate community voice for true operational impact for the Healthier Oregon program and for the 1.5 million Oregonians going through Medicaid redeterminations. Let's take that and document that into practical tools that you can use even when you're going into lizard brain. So really we designed a beta toolkit. We said it's beta because we know that those two experiences do not represent all of the wisdom and knowledge that so many other staff and state agencies, many of you perhaps have, and other particularly Oregon Health Authority staff leaning into this work, thinking about what does it mean to have community co-create and lead with equity and address health inequities through community voice, making it operational. There's so much more we have to learn, but we took our learnings, what we were able to do by getting the cable cords connected to our head to this next slide, and created what we hoped is a supportive beta toolkit. And Amy, if you go on to the next slide. That really looks at different sections and sort of had mapped out everything we had. So it was really able to navigate from one section to another easily. It had actual steps, tools, and tips that staff can use. So that steps like, just look here, you got to do a work group, follow step 1. We tried to put the tools, actually taking a lot of the instructions out of the step and put them directly into tools. So as an example, create a charter. Well, we just had as template the community partner work group charter that walked through a lot, or in a blank template charter, walk through a lot of the operational pieces of how to decide things, so that we didn't have to put it in the instructions, but created a tool that people could easily use. And then other additional tools, and then some tips of like really tried to do at the highest level so that as you have that lizard brain panic and you're not able to process too much information, you just need to know which way to go that isn't underneath your desk to the dog bed, but like actually moving forward to get a work group operational. What's the key information you need to know to get you on that path? And that's really how this was designed. And you can go on to the next slide, Yami. So what we have in this is really just that overview, how to design the work group, that charter. We have samples, we have templates, we have additional resources. That worksheet 1, calculating staffing and membership as an example, is where we took and said, let's document the minimum FTEs needed, so that someone who's being thrown into this is like, hey, great, welcome to your state agency. We're so glad you've been here for 1 month. And since you don't have all your job responsibilities yet, let's have you lead this work group. They can sort of know what this looks like and what really resources should be able to have and have that documented. Thinking about reimbursement and how to do that. So that's just an example. And then we also if you go to one more slide, Yami, the next one down. Oh, I added one more in, but never mind. Maybe I didn't. I thought I had added in resources, but I probably didn't. I was in here during. Totally okay. So yeah, I can actually, but we try to, I can share my slider real fast if we want, just to show it to you.
I got it.
Oh, you got it? Did it go up? Perfect. But we took compiled resources at the end to like sort of have a lot of those tools too. But that's something that we did. If you are the link, it's on our Oregon Health Authority. This is on our Oregon Health Authority External Relations Division SharePoint site, this toolkit. So haven't figured out a good way to make that accessible to other state agencies necessarily, and happy to figure that out if it's something that others are have interest in seeing as well. But think there's a lot more. I'd love to see the Oregon Health Authority continue championing like that work group communities of practice, and thinking about that not only for project managers, but the subject matter experts, those supporting community voice and operational action, and how a toolkit to how those practices can best be seen. So there we go. Thanks, Yemi. So appreciate it. Sort of showing some of the different resources. And we really worked closely with our equity inclusion division to ensure we identified resources that would support just our agency standards around accessibility, accommodation, language access, our language and style guide, and really thought about a lot of those things, the compensation forms, additional resources, that charter, and just try to capture some of what we learned along the way and had to sometimes admit ourselves. So with that, I think we can sort of turn it back over to you, Amy, for any additional questions.
Okay, thank you so much, Sarah, Hildy, and Yami. Does anyone have any questions? Feel free to raise your hand. I think you all have been very thorough. Really appreciate that. I'll go ahead and start closing if that's okay with you, unless you had anything more to share. Okay. I placed a link to a survey in the chat that will help us improve the future PMUG experiences, and to nominate yourself or a colleague as a future speaker. We hope that you've enjoyed this presentation. Thank you so much for attending. You can look for a follow-up email with links to resources, and please share with your team members and those who may not be on the PMUG listserv to reach out to me, Amy Croucher, to be added. And again, if you're interested in learning more about the business analyst processes or participate on the BANG planning team, visit the BANG website shared earlier in the chat. Also, BANG has invited the project management user group participants, to attend the April BANG forum on business case development. So look for a Teams meeting info in your mailbox soon. Enjoy the rest of your week. PMUG will convene again in May. Thank you, everyone. I'll just be staying on a short while longer to download the recording.
Thank you so much for having us.
Thank you.
Thank you.